is probably worse when it involves a child. It's bad enough to hear it happening to an adult, but when you hear it happening to a child, I mean, that's probably worse. Definitely isn't anywhere as common in children as it is in adults. And the cancers in children only account for less than 1% of the total amount of cancers that we see in the country. How many of you have had cancer, or know somebody who have cancer or had cancer? Just raise your hands for me, please. A lot. How many of you know of a child who have cancer or had cancer, somebody that is close to you? And you see only maybe 1, 2 hands went up. So this gives you an idea of how much more prevalent or common it is to have cancer in adults than it is in children. We have had a lot of improvements in our treatment or diagnosis, and with that we have seen improvement in the outcome of cancers for children. We usually have much better prognosis or very better outcome in our children cancers than we have for adult cancers. But in spite of that, a lot of children with cancer do die. And in the group between 5 to 14, it is the second leading cause of death in children. So what is our rate of cancer in the Bahamas? We see about 8 new cancer cases at Princess Margaret Hospital per year. 8. We believe that it's probably a true incidence of what the total number is, because unlike a lot of diseases where people may travel abroad for treatment, with cancers in children, the treatment is usually over several years. Unfortunately, a lot of our children are not insured, and the cost of cancer care is expensive. So most of them will end up at Princess Margaret Hospital somewhere along the line. So I get to see most of the children with cancer. So I think that the incidence that we have here of 8 new cases is probably a true reflection of what the true number is. So how do we compare with other places? We have very little published data for the Caribbean, but there is in fact some published data for Trinidad, and their rates are a little bit lower than ours. And you'll notice that the rates for the US and for the United Kingdom is actually more than ours. And that has to do with probably a little bit higher incidence of cancer in the Caucasian population and some other genetic and ethnic variation. In addition to which, we know that in a lot of the developed countries, the rates of cancers are higher than in the underdeveloped countries. Now, some of that might be because the children in the underdeveloped countries don't live long enough to have the cancer. So a lot has to do with looking at several different factors before you come up to a determination that we just have less cancer than in the developed countries. And how does this compare to our adult rates? So, on the way I asked Dr. how many cancers you see again in the adults? And he reminded me that they see about 300 cases per 100,000. So their rate is almost 40 times ours. Again, just to emphasize how rare it is for children, how much more common it is for adults. What are the types of cancers we're going to see? It's the same types that they see everywhere else in the world. Number 1 is leukemia, cancer of the blood. Number 2 is brain tumor. Number 3 is lymphoma. And ours is a little bit different because our 3 is shared by soft tissue tumors, tumors of the muscles, for example. And this is a little bit different from the variation of types of cancers that you see elsewhere in some of the developed countries. And then there are some others as well. This just shows the distribution of cancers. And again, you'll see on the far left-hand column how much more prevalent or how much more you see leukemia cases than all the others. metastasis in children is that some of the symptoms and signs are similar to what we have for some of the common diseases in children. Fever, for example. If you carry a child who had a fever to the doctor to say that they had cancer, we have a lot of unnecessary investigations. So we'll talk about the key take-home point. If it is unusual or persistent, check it out. With regards to the presentation, it varies depending on the type of cancer. So for the leukemias, they will have unexplained fevers, tiredness, they'll have bone pain, they'll have paleness, all of which signifies that the cancer is affecting the blood cells. With regards to the brain tumors, we're talking about headaches, vomiting, especially early morning vomiting, stumbling gait, maybe weakness, cross-eyed. With regards to lymphomas, we're talking about swelling of glands, swelling in the neck, swelling in the armpit. With regards to soft tissue tumors, we may have swelling of a particular site. It may or may not be associated with pain. With regards to Lund's tumor, the tumor of the kidney, it is not uncommon for that to be picked up by a grandmother who is bathing the child and notice that she's feeling something in the tummy that she didn't notice there before. And no other signs, no pain. Those children may have some blood in the urine as well. With regards to eye tumor, they may have problems with vision. If you suspect that something is not right, go get it checked out. Now when I say get it checked out, it doesn't have to get checked out by a specialist. You can get it checked out by your usual pediatrician, the person who's been following you all along, the person who knows that child almost as good as you do. And then from there, depending on the symptoms and the signs, they will refer you for further laboratory investigation and maybe, hopefully not to me, but maybe to me as an oncologist. The evaluation should include a complete history, a proper examination, and those alone should determine whether or not you need to do any preliminary investigations and any special investigations to better decide whether or not there is something that you should be worried about. The confirmation, though, of whether or not this is something serious often entails getting a biopsy. We have to sample something to let us know that there is cancer. Because the treatment is quite intense. You want to be sure. After that, what? For the most part, after the confirmation is established, you go on to stage it. What do we mean by staging? We need to know what is the extent of the disease. How much has it spread? And when you hear a spread, it's usually they use words like metastases. That means it spread beyond the place that it first started. We need to know all of that because the intensity of the treatment and the type of treatment will be determined by that. The treatment options depend on the type of tumor and on the stage of the tumor. And for the most part, there are three modalities or three types of treatment, almost regardless of what cancer it is. Do you need surgery? Do you need to cut off the tumor? Would that help? Do you need surgery plus chemotherapy? Would that be better? Do you need surgery plus chemotherapy plus radiation therapy? All of that depends on the type of the tumor and on the stage of the tumor. So what should we do? What should you ask? Well, once you know what the kind of tumor it is, you need to do some homework. You need to go to Dr. Google, who does not mind what time it is, and he doesn't even charge you, other than for the internet bill. But he doesn't charge you. You could ask Dr. Google any question you want. However, there's a lot of information on the internet. Some of it may be good information and accurate information, and some of it may not be so good and inaccurate information. So what you need to do after you've done your research is to bring it with you to the physician so that you can have a very good discussion, so that you can make an informed decision, make the right choice for your child treatment. So what kind of questions do you need to ask? You want to know what is the prognosis. In other words, if I give the treatment, what is the likelihood for cure? What is the likelihood for her to be alive several years from now? Does it change if I choose one option over the next? Is it better if I do the surgery rather than chemotherapy? You might even want to find out if there are any open research trials available, because sometimes there are research trials that might benefit not only her, but oftentimes it is to answer a question as to whether or not we can find a better treatment option for her and for future patients. So it's okay, you can look into that as well. You want to know how long is the treatment? Because if you decide that you want to take her to Miami, are you going there for a week? Or are you going to go there for 4 years? You want to know, where can I have it done? Can I have it done locally? Or do I need to travel in order to get the better outcome? You want to know, what are the side effects of treatment? How much will it cost? Because it's not free. Definitely not free. A lot of the chemotherapy agents that we use are expensive. Radiation therapy is available locally, but that's expensive too. So the newer drugs that we have that can help us to better treat some of the cancers, they're expensive. There's nothing about cancer that is cheap. And you want to have an idea. Now I'll let you know that at the Princess Margaret Hospital and the government, they say that treatment for children less than 14 is free. But I think free has varying definitions. So what I oftentimes encourage patients to do is to try and make some contribution towards the cost of their care, no matter how small it is. Because if nobody makes a contribution, then sooner or later, the money is going to run out and nobody will have anything to buy the drugs with. And so not only will the next patient not get it, you may also not get it. So I always encourage the person to pay something. And in fact, when they do go to the oncology center for their chemotherapy, they are oftentimes presented with that. The good thing for me though is that they still give the children the treatment even when they don't pay the bill. Because technically, they're supposed to have free treatment. But they always ask them for payment. And I encourage them to pay. You want to know, can they go to school? Should school be a priority? Is it safe for them to go to school? Because the costs may be low. What about the vaccines? Can they get the vaccines during the time of treatment? After they finish treatment, can they start back the vaccine? Because you know, the schools won't admit them unless they have all the vaccines. So you're going to need to partner with the doctor to make sure they write the right letters to get them into school, but you also don't want them to get the vaccines too early that will cause them complications. And of course, you want to know what are some of the long-term complications. You want to know, can they have children later on? Now, oftentimes, because I'm treating children, I don't worry too much. I'm so busy trying to keep them alive now that sometimes I forget to go through all the complications I wanted a child. You should have asked me. Ask a 5-year-old? Oh, okay, that's a little rough. But when we have the adolescent patients, we sometimes have the option to do sperm banking or preserve the eggs. That is difficult for us here, so I don't have the luxury for that level of discussion. So I'm partly just trying to keep them alive right now. But hopefully we'll get to the point where we can do those things, and so the long-term survival will have other options. This is no different from grieving for any. When the parent hears the news, it's impossible, it can't be mentioned. There is no way God would be that harsh and wicked. He wouldn't do that to me. Can't. Today, in a state of denial. Then they get very angry. Right? Sometimes stop going to church. Really angry with the world and with everybody. I remember it took one boy 4 years to start to smile again and talk to him. Then they started partying. God, if I do everything that doctor asked me to do, which is causing my